Good morning, guys. Tony Maritato here, licensed physical therapist, and in the Total Knee Replacement Support Group for Kind People on Facebook, a question came in about pain around the front bottom side of the knee itself after the replacement. So the member of that group mentioned that they get occasional intermittent pain. It's severe when it happens. It doesn't happen all the time. And she actually posted a picture with a little circle. And so whether we're talking about the outside edge or the inside edge of the knee on either side of the patellar tendon, usually what I see is there's a severe sensitivity that happens right at the top of the tibia. So the tibia is your shin bone. As that shin bone comes up during the surgical procedure, they remove the top of the tibia, they put an implant on top of it. But what I believe might happen for some people is at the joint where the implant sits on top of the natural bone. There could be a little bit of injury there that happens to the bone. Nothing severe, and in every single situation that I've seen over the last 20 plus years in the clinic, it's always resolved for the individual. But there are points where it becomes super sensitive, tender to the touch. Now, we've had other videos where we talk about pes-anserine bursitis. That's usually lower than this area. This area is kind of right at the joint line where that implant sits on top of the tibia. So while it's frustrating, while it's certainly concerning, it has to be checked out by your orthopedic surgeon. In most of the cases, if not all of the cases, at least that I've seen, that sensitivity usually resolves somewhere around the 12-week mark. It might take longer depending on the severity of it, but it is relatively common. It does usually get better, but it is something that should be assessed by your orthopedic surgeon. Typically, they'll do an x-ray, they'll look at the bone, they'll look at the implant. Most often, they're gonna say everything looks like it's doing well, looks like it's intact, even though you're feeling that pain. You know, the problem with imaging is imaging can't see the cause of your pain or your pain itself every single time. So we need to use kind of our clinical judgment to make a determination. But like I said, I think what happens is where the implant sits on top of the tibia, the natural bone, there's maybe a little bit of an injury to the bone right at a certain spot. If you push on it, it's tender, it hurts. When you move in a certain way, it hits that spot with stress, and it's a piercing, extreme pain. But then it relatively quickly subsides. So if that's what you're experiencing, I wouldn't be too worried about it. If you've already had your orthopedic surgeon check it out, talk to your physical therapist about it. Maybe there are some desensitization strategies that you can try. We talk about some of that in other videos on this channel. Otherwise, guys, thanks so much for watching, and I'll catch you on the next video.